Good afternoon and welcome to United TV. Our Bariatric Friday is about to start, and Dr. Irgau is going to join me as usual. And we are going to discuss the day of bariatric surgery. We are going to prep our patients, what they need to do, what they should expect. As many of you know, these are already in our playlist by topic. So we are trying to cover these in different ways. So if there's any more information that you need on this topic other than what we discussed today, please go to our playlist for this specific topic, and they're nicely organized for our patients and for anyone who's looking for more help. So, Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be on another wonderful session of Bariatric Friday.
Always good to have you here.
Thank you.
So you are the reason we do these. So thank you. And your commitment and being able to, put the time for this, and it's very important for us.
My pleasure.
So because of the news cycle that we have for this, I try to kind of keep this specific format, so then, when we are covering again, we'll do it in a different way. But I must start with questions, and I may have some additional stuff here and there. So now patients are ready. They're the day of surgery. They are going to be getting their surgery. Now, what time do patients typically arrive at American Surgery Center, and what happens upon arrival?
Absolutely. So patients will typically arrive about 90 minutes before their scheduled operating room time. And they are greeted by our team. They're checked in at the front desk, and then they will be guided to what we call the pre-op area, which is essentially the area of preparation of the patient for the procedure,
right,
where there will be different teams, the nursing teams, the anesthesia teams, the surgical teams, interacting with the patient and doing their part to prepare them for the surgery, essentially. In that area, they will be changing into their gown. An intravenous line will be started. And then the anesthesia team will come and talk to them, go over their history, and then they will explain what the role of anesthesia is. And they will be discussing with them the anesthesia side of the surgery, essentially. And then the surgical team comes, and of course the surgical team has been meeting with the patient, on several occasions before that, but there will be a time also for the patient's maybe questions that may have arisen since the last meeting to be discussed. Typically, a family member will be also sitting at the bedside with the patient at that time, and they may have questions as well that can be discussed. And then that preparation is completed, and the patient will be going to the operating room for the surgery.
Sure. Now, surgery, even if well planned, comes with emotional stress. Handling this well is the key for a good start for our patients. How do we help patients to manage their anxiety the day of the surgery?
So this is a very important point. Of course, success of the surgery will depend on the experience of the surgeons and of the center as well, which we have, having been doing this for almost 25 years now. But, although from our point of view, it is fairly routine because we do these surgeries time and time again, from the patient's perspective, it's a once-in-a-lifetime experience, essentially. And we have to understand that. And our center has to be prepared for that. So really, more than a hospital, it feels more like a healing place, in terms of the calmness, the well-orchestrated sequence of events that occur at that time. We understand, as I say, that patients will be apprehensive about what's going to happen, and we're there to talk to them, to explain to them. We make sure the environment is very, very calming in many ways. And this includes all members of the team that will be interacting with the patients. From a physical comfort point of view, of course, we have warm blankets. It's a very inviting and very calming atmosphere around in the pre-op areas. Sometimes, if the anxiety level is a bit high, we will be using some breathing exercises, taking our time with the patients. But very often, having that, not rushed atmosphere, but a calm atmosphere where the patient knows and feels that they are the center of attention of everybody at that time, by itself can be very calming. Of course, sometimes we may have to administer some mild sedation medications to ease the anxiety, particularly on people who are used to taking, anti-anxiety medications to begin with, which we obviously will have identified beforehand as well.
Sure. Now, another thing is transparency about the surgical process. Builds trust and prepares patients mentally. So, if you can walk us through what happens in the OR and how long the surgery is going to take.
Absolutely. So, in the operating room, we have very much up-to-date and modern laparoscopic equipment that we utilize for the surgery. The surgery itself takes about 45 minutes to an hour when it comes to something like the sleeve gastrectomy. It could be as long as an hour and a half or 2 hours, depending sometimes when it comes to the gastric bypass, essentially. That is something that we obviously go over on a number of occasions with the patients, because obviously they will be asleep when we do the surgery. And we obviously are extremely privileged to have their trust in us taking care of them at that time. So safety is extremely important for us. We have a number of steps that we do and rehearse all the time in terms of adhering to a particular sequence of checklists that we do. There is something called timeout, for instance, that we do before the surgery, where everybody will go over the fact that we have, Mr. So-and-so or Mrs. So-and-so. This is their date of birth. This is the diagnosis. This is the procedure we're prepared to do. These are the allergies that they have. This is the medications that we usually administer that have been administered already. The equipment is functioning and we've tested it. All this we go over and over all the time. It is part of the safety process that we've implemented, and we go through that religiously time after time, essentially.
So early post-op care is critical to prevent complications and help patients to recover faster. What's the first thing you and the team checked for post-op in the recovery room?
So early post-operative time, particularly the first hour, the second hour after surgery, are critical in terms of identifying potential complications. For instance, bleeding. So in our surgery center, we are fortunate to have a 1 nurse to 1 patient ratio during that period of time, which means that the nurse will be assigned to continuously monitor that patient for those 2 hours. Just that patient is assigned to them. So they will have monitors that will be continuously monitoring the what we call the respiratory rate, which is how many times a minute the patient is breathing. They will be monitoring the oxygen level on a continuous fashion. So it's a monitor attached to the finger of the patient that will bring about a readout on a screen as to what percentage of oxygenation is that patient going through at all time. Of course, the heart rate. And then there will be frequent checks of the blood pressure as well. We call this vital signs. They are important indicators on the recovery from anesthesia. So this we will be watching. Of course, there will be other issues as well. There may be nausea, for instance, that may require medication. There may be pain that may require medication. I'm very happy to say that, for instance, pain is not a major issue for us, because rather than chasing pain after it has occurred, we take care of it preemptively. I just saw a patient today in the office who came, for their post-op visit, and they were telling me they could not believe that they had surgery when they went home. And more importantly, their family members could not believe that they had surgery because they felt so good afterwards. And that is because, as I said, we take a number of steps to prepare the patient even before the surgery. to minimize the degree of discomfort that they have. Typically, patients will have strategically placed numbing medicine on their abdomen when they are asleep, so that when they wake up, they would not feel the incision pain, essentially. All those things help us greatly in getting the patients to recover very quickly, which is very important, as it will be apparent
Absolutely.
from our discussion, essentially.
So I think time to time you mentioned the pain and what we do for prevention. And for those who are watching, pain has a lot to do with our body, the part that is in pain, communicating with the brain, and that takes time, right? So by the time something starts happening, and brain process that and then responds, and that's already too late.
Absolutely.
So when that communication that happening, that signal goes, if you are able to stop that signal before it goes to the brain, I guess that's kind of like the key. And even like not on outside of the surgical setting, yesterday I knew that I was gonna get almost like a migraine-ish headache. Like it was building, and there are times where I would just take my time not to take anything. But this time I said I need to make sure that this doesn't elevate, because once it's at that point, I won't be able to work. So, and I took what I needed to take and was able to control that. So, in the surgical setting, patient is already going through some trauma with the body that's going through a lot of stress, and if the unnecessary communication that can be prevented, that's just less toll on the body. So
Absolutely. I mean, when you look at the history of surgery, one of the greatest advances in medicine has been the advent of anesthesia. You can imagine how difficult it was for the patient and for the surgeon when surgeons were performing surgery without any anesthesia, with the patient awake and feeling the discomfort. Anesthesia has resolved that issue because patients can be safely put in an unconscious state where they don't feel any discomfort when the surgeon is working through very complicated procedures, sometimes taking several hours. Another big challenge for us as surgeons is really to minimize discomfort after surgery.
Right.
And we have the tools to do that now, right? I mean, when I was training, I always tell you that one of the things that used to bother me was watching a patient waking up from anesthesia. They would have a big frown and they would be unhappy because they are in pain. As they are coming out of the anesthesia, they're feeling their incisions, and the anesthesiologist would be pushing these medications. And those medications by themselves are strong medications that almost put back the patient to sleep again. You want to wake them up, but you're giving them medications that do that to take care of the pain. But if you are able to take care of the discomfort when the patient is asleep, like this numbing medicine that we administer that I was telling about, it's called the top block, then the patient will wake up and they will be surprised that the pain that they expected to have is not there. That mindset sets them in a much better position to really tolerate the discomfort that they may have later when they go home. You see, very often we're more afraid of the pain before it happens than the actual pain. We really suffer expecting there will be a lot of pain, and we shy away because of that. But if we're pleasantly surprised that actually there is not pain, then whatever pain may come later, we're much better at tolerating it. On the other hand, if we experience a lot of pain as we are waking up, we will be terrified by what may happen later, right? So any little amount of pain, we're worried that it might explode into a big pain. So we take pain medication, and that psychologically doesn't help our recovery.
Right.
So recovery actually is helped greatly by addressing this very fundamental issue, which is pain control. And I believe we've done very, very well with that, with the methods that we currently have.
So patients often worry they will be bedridden when in fact early mobility is the key for the recovery. So how soon are the patients encouraged to walk after surgery, and why?
So this is important for recovery. There's no question about that. Getting patients to walk early after surgery is probably one of the most important things that has happened to reduce complications of surgery. In our surgery center, as early as 2 hours after surgery will patients be encouraged to start walking. Now, for some, it may be 3 hours. For others, it may be 4. But for many, it could be as early as 2 hours after surgery. And then that is a habit we want them to continue even after they go home, essentially. So walking frequently is very important. Not only it's because it sets them up psychologically to have this recovery role as opposed to the sick role. You see, when you're lying on a bed and everybody is standing above you, looking at you, you kind of assume this role of the sick person who is incapable of doing anything and depends on others to do everything for them, right? That doesn't help recovery. That delays recovery. On the other hand, when your brain sees that you are vertical like everybody else and you're walking by yourself, that enhances recovery. On top of that, of course, walking early reduces the risk of blood clots, reduces the risk of pneumonia, and many other complications. So patients are encouraged to walk very early, and we help them to do that. And you've seen in the surgery center how patients are walking around the halls, soon after surgery. And we encourage that habit when they go home as well.
That's the biggest problem, misperception ever in healthcare, I guess, where patient they feel like their system makes them feel like they're safer in the hospital. Well, that's not the case. So patients are recovering better at home. If you're able to, just like the same logic, they need to get up because we don't want them mentally feel ill or not well or not equal. So then it all starts here. So then because of that, we need to make sure that we are going back to normal as quickly and as soon as possible. So if you don't have to be in the hospital, for example, many patients still, a lot of programs, they keep their bariatric patients one night. Well, if I can sleep at my own place, why do I need to sleep in the hospital? It exposes me to so many other issues and risks, and my home is the safest if clinically it's the right place to be. So that's, in time, like we learn a lot of things through you and other surgeons. So this is, it's almost like a taboo, like you couldn't even question it in the beginning. You remember, like when like not you, like I'm talking about us, like public, non-clinical, like, hey, like, well, let them stay. Like, no, they can recover better. So that was, I spent at least a couple months to kind of, go over that to process it properly. So then I knew that this is the right thing to do. But I understand how difficult for people to say, hey, I'm going to do this in the hospital. Well, a lot of other sick people are there. So if you don't have to, you don't have to go to the hospital. And if you can be home, you should be home. So, and if you can walk, you have to walk. So this is kind of like all goes together.
Absolutely.
Now, they're done with their surgery. The new stomach needs time to heal.
Yeah.
Misunderstandings could lead to complications. So how can patients eat or drink anything on that day?
So they definitely cannot eat. As you mentioned, the new stomach is still very, very sensitive. In fact, for bariatric patients, we really do not allow any solid food for the first 2 weeks after surgery. And but we do introduce drinking early, right? Within the 2 hours, 3 hours after surgery, as soon as we know they are fully awake and they have full control of their ability to swallow, we actually encourage them to have some liquids. And we start them with what we call sips, okay, or ice chips. I think that is actually a good thing because most patients, although they're being hydrated through the IV, they still feel their mouth is dry at that time. And that freshness of having some, cold liquid in their mouth actually is very welcome by them at that time. But we start them early. And one of the criteria that we have to fulfill before discharging patients is obviously their ability to tolerate oral intake. And we start them early to see how they can progress. When they go home, they will still be on a liquid diet, but that liquid diet actually starts at the surgery center.
Absolutely.
Yeah.
Now, dispelling myths help patients help confident and empowered. So, what's the common myth or fear patients bring with them that morning?
Well, I mean, clearly, as I said, for the vast majority of patients, this is going to be a once in a lifetime experience. Some patients may not have had any surgery before that time. So their expectation is that this is going to be unbearable, that it's going to be difficult, that they will be walking hunched, for days after the surgery. But it's amazing what they will tell you afterwards, that it's going to be so much better than they expected. In many ways, in their ability to, to not have discomfort much, really. Most patients will be taking pain medication maybe the first day, 2 days after surgery, and then after that they stop, despite having the medication prescribed to them. And then also their ability to tolerate oral intake. Very often they will either be online or on social media reading about, patients throwing up and having difficulties. In our program, that does not seem to be an issue at all. I cannot remember the last time I had a patient calling me because they're throwing up. Clearly, that is a potential complication. We know it can happen, but it's not the most common, thing that happens. So a lot of patients will have really these concerns that it's going to be difficult for them to go through this, or they will go through it with a lot of difficulty, and yet they are pleasantly surprised on how well tolerated the whole process is. And that's our goal as well. I mean, no one wants to have surgery, but if you have to have surgery, it's important that we provide the safest, most comfortable experience possible, so that patients look back and say, hey, I needed to do that, and now I am on the other side feeling really good about it.
Right.
Yeah.
Right. So mental preparation is just as important as the physical preparation.
Absolutely.
So what mindset do you encourage patients to adopt and when they wake up on the surgery day?
So essentially, as I said, this process starts way early. As you know, after we see patients on consultation, we see them on a number of occasions as they are preparing for bariatric surgery. And they're also seeing different members of the multidisciplinary team, including the nutritionist and psychologist. And all of us, bring about the same message. And that is, this is important thing for them to do, that we will take them through this safely, that these are the steps that we are going to take. But also, we talk about what patients need to do on their side to prepare for this, right? That it's very important for them to understand the instructions that we provide them, and that for them, they have to follow those instructions clearly, like we have asked them to. One of the issues, for instance, as I was telling you before, may be the progression of diet. Now, many patients say, why do I have to be on a liquid diet for 2 weeks? Well, it's important. It's a very freshly cut stomach that has been operated stomach, right? It's still very sensitive. The last thing we want is for them to swallow something that didn't chew very well, that could put so much pressure on that wound and create problems. So it is important for them to follow those instructions. Now, sometimes it feels really daunting to think that you're going to be on a liquid diet for 2 weeks. And it is, of course. But when you've had surgery to reduce the size of the stomach, it is really surprising how well patients tolerate that. They think they will be very, very hungry and famished because they don't have solid food, and yet they don't. In fact, many patients have to remind themselves to eat because they don't feel hunger at all.
That's what I was going to point out. So main thing is you are not going to have the same feeling about hunger after the surgery.
Exactly.
So that's especially with gastric sleeve, that part that makes us hungry, that sends the signal to the brain saying that, hey, send me food, that part is gone.
That's right.
So you're not going to go to that process after surgery with that mindset, I'm going to need the same level of food because there won't be necessary signals or unnecessary signals to trigger that, right?
Absolutely, absolutely. But like many things, you don't know that until you know it. You know what I'm
Right.
saying?
But that's why we do this.
Exactly. Of course, of course.
So,
This is part of the preparation,
right,
right? Yeah,
right. So,
absolutely, absolutely. Thank you for Bariatric Friday.
right, it is. It's like, I always use my example of my dentist. Like, I don't have pain associated with my dentist. And many
That's great.
people, they have
Yeah,
the fear of dentists
yeah,
because of that. But
yeah.
and
Kudos to your dentist.
yes,
Really, really.
Dr.
Absolutely,
Radio is a
absolutely.
great one.
Yeah.
So the bariatric surgery, because of the social stigma, and I believe next week we are going to cover that. There's a lot of social concerns out there, and having our family, our friends on board is important. How involved is the family or support person on the surgery day at American Surgery Center?
We want them to be as involved as possible. As I mentioned before, patients will have their family member actually sitting beside them during the pre-operative preparation in the what we call the pre-op area. So very often I will see the patient on the stretcher, but then there will be either one or two chairs on each side, and there will be one or two family members sitting beside them, supporting them during that time. And it's important for the family members, to listen to what we are explaining to the patients, not only because they will be better at supporting the patients, when they have the knowledge of what is happening, but also because they will have questions themselves as well.
Right.
Very often, when the surgery is being performed, they will be in the waiting area. Sometimes, if they have other engagements, they will be going and they will leave us their phone number for me or one of the other surgeons to call them and let them know that everything went well. This is important for them. And obviously, there will be apprehension and anxiety despite our assurances. And they feel so relieved when they hear my voice or the surgeon's voice telling them, hey, we're through, everything went well.
You are doing well.
Absolutely. And then, as I said, that brief period early after surgery when there is intensive monitoring and the patient is not really awake enough to interact with the family member as well, there will not be any family members present. But after that, the nurses will be talking to them. If they want to come and engage with the patient at that time, they will. Of course, it's going to be very important that they are present when we give the instructions about what to expect at home, what to do, what medications to take, because they will be the extra person who will hear the instructions and support the patients as well. We expect our patients to be fully independent, to take care of themselves when they go home, fully. Right. Whether it's washing themselves, walking, going up or down the stairs, we want them to be independent. But it's important to have a support person, particularly the first night, to be there, either psychologically supporting them or for any,
based on their BMI level, they may need physical help as well.
They may. That's absolutely true. Absolutely. Yeah.
All right. So that's all we have for today, Dr. Irgau. So I think just having the questions and answers, just so that some of these things can be readily available for our patients.
Absolutely.
I know what we do is a public service right now, as it may look like we are promoting our own program. Yes, we are, but it's also a public service. So anything that you can learn from our sessions, you are able to apply to other programs.
Absolutely.
The day of bariatric surgery can be fearful, and we want to make sure that our patients are following our instructions and knowing that we will be there for the support. Now, when you decide to make the decision for bariatric surgery, or if you feel like you need this, start with your primary care and get the medical consultation from them. That would be a good way to start the process, and then come to us. Or if you don't have the established primary care relationship, come to us directly, and we will still keep you in touch with others in our multidisciplinary program. So we are hoping that this is reaching out to those who really need the help and then can overcome their fear and take that next step and for better and healthier life. So until next Friday, stay united. Bye-bye.
Thank you. Bye-bye.